So the one thing that we need to start with is we need to understand that this is especially for the students. Now, even a conventional doctor has a lot of history taking. In India, the conventional doctors, the MBBS doctors, they don't tend to take a lot of history in detail. But if you go to the Western world, if you go to, you will find that even the allopathic doctors, the conventional medicine doctors, they take very long history. They spend a lot of time with patients. But there's a difference between the conventional interview and the homeopathic interview. And we should not be misguided by just the detail of the uh, interview, because the purpose of the interview, of a conventional interview and a homeopathic interview, is different. A conventional interview is a verbal communication interaction with the patient for a specific purpose and is focused on a specific content area. And the problem, there are two types of conventional interviews. One is a problem seeking interview and another is a problem solving interview. But most of the interviews that you will see in conventional medicine, they are problem seeking interview. When we say problem seeking interview, the patient interview is focused on finding the disease diagnosis. That is the largest purpose, the biggest purpose of a conventional interview. And herein lies the difference between a conventional interview and the homeopathic interview. Because the homeopathic interview, which is called case taking, the whole process, the purpose of that case taking is to find the remedy, not the problem. It's not to disease diagnosis. We are trying to find what, we are not trying to find what is the problem. We are trying to find what caused the problem and what is it that is going to solve the problem. So the homeopathic case taking is focused more on the eliciting the etiology. What Hahnemann has written, the exciting cause of the acute disease and the fundamental cause of the chronic disease. So the idea of homeopathic case taking is that we try to identify the exciting cause of the acute disease and the fundamental cause of the chronic disease. And the end result should be that we are able to identify the right remedy, the similimum. The whole purpose of the case taking is, and that is how we define it. Case taking is the process of collecting all the facts about patient using various tools like observation, perception, history taken, given by the patient, attendant, clinical examination, doctor's observation, etc., in order to find the remedy for the patient using our knowledge of homeopathic materia medica, organon of medicine, and repertory. And the whole idea is that we are trying to find the remedy. That is the crux. So never forget that what is your idea of case taking. I'll tell you something. Very early in my practice, I realized that I got exposed to a particular school of system. And I was in awe of the way the practitioners of that particular approach used to take cases. So I learned that approach. I did some seminars and I felt like, okay, now I know how to take the case. So I'll take the case for like 2 hours, long case history. I'll go deep into the mind and the delusions and try to figure out the sensation of the patient. And after 2 hours, I had like a plethora of symptoms, a huge bundle of symptoms, yet I would not be figure out the remedy. Why I would not be able to figure out the remedy? Because I had learned the way this particular school took the case, but I had not learned how to solve the case according to their approach. And the repertorial approach that I used to follow had no use of the symptoms or the information that I was eliciting from the patient. So if I take a case for an hour or two and if I cannot figure out the remedy, then it's useless. And this happens not just with too detailed a case sometimes, it happens with too shallow case taking also. And this even Kent had mentioned sometime. If you read somewhere in his lesser writings, he has mentioned that a student brought a lot of symptoms, a case to him, and he said that you don't have any case. And the student asked him why, but I've taken all the symptoms. The Kent said that you have a lot of symptoms, but you have missed out on all the characteristics symptoms to find the remedy. So despite having a long case history, if you are not able to find the remedy, then the purpose of case taking is defeated. We are not just trying to understand the person in front of us. We are trying to understand the person in front of us so that we can find the remedy for that person. Never let that get out of your sight. Because sometimes it happens, especially with young practitioners, that we get swayed by the story of the patient. There is a term in psychiatry called emotional entanglement or the patient physician entanglement. If we get entangled with the patient emotionally, if we get swayed by the emotions of the patient, even then we miss the case. We are not able to find the remedy. So we have to make sure that when we are taking a case, we never lose the sight of our ultimate goalpost. And the goalpost is that we need to figure out the remedy. And in this effort to figure out the remedy, we have to focus on the patient as a whole. This is again a difference between the conventional interview, because conventional interview can sometimes focus only on the part that is having the problem. But in homeopathy, even if the patient is coming to you for a small part, for any part of disease, we take the patient as a whole.